We begin tonight with a look at how ambulance services are being affected by Michigan's COVID-19 surge.
Are response times longer, and what does it mean when an ambulance is diverted?
13 on your side's Keely Lovern asked those questions today. She joins us live now from downtown Grand Rapids with the answers.
Good evening, you guys. Earlier today, we learned that University of Michigan Health West actually had to divert some of their ambulances yesterday and part of today due to an overwhelming number of patients in their emergency rooms. Now, by this evening, we were told that they are back to accepting patients, but I wanted to sit down with some of the ambulance companies here in West Michigan to talk to them more about how this fourth surge is impacting them.
I think all healthcare providers are finding it challenging times, being that we're going into year 2 of the pandemic.
And that includes ambulance services, EMTs, and paramedics.
We're all working together. We're, in a lot of cases, from an EMS perspective, we're an extension in very basic terms of the hospital emergency department. Everybody's having challenges with the resources that they have, and so we're all doing the best we can to work together to take care of the patients that need our care, which is job one, and just having to be more creative to try and make that happen in some cases.
And that's the case for University of Michigan Health West, which temporarily had to divert some of their services this week due to an overwhelming number of patients in their emergency room. This means ambulances were forced to route patients to the next closest hospital that was open with capacity. In a statement, the hospital said in part, quote, "This persistent surge of cases should serve as a wake-up call that we cannot afford to let down our guard against COVID-19.
Everybody just, through the challenges of some of the staffing issues and whatever, is just doing I think a good job of communicating with each other.
Mark Meyer says, above everything, though, it's still important to get care if you need it because this is adding to capacity issues.
While there's certainly challenges with capacity and staffing in some circumstances, don't defer help. Because
Meyer also says they're committed to hiring more EMS workers. This year, Life EMS has trained almost 200 EMTs, and that doesn't include other training programs here in West Michigan.
We've all seen different types of challenges over the years, and this is a serious level of resource availability that we've got to get through, and by all of us in the healthcare system working together, we'll get through it.
I also reached out to AMR here in Grand Rapids, and I haven't yet heard back from them, but we will continue to follow this story and how this fourth surge is impacting you. I'm reporting live in downtown Grand Rapids. Keely Lovern for 13 on your side, and Juliet will send it back to you.
Thank you, Keely.